I watched my mom go through hip replacement surgeries when I was pretty young, and it thrust her into metabolic dysfunction. And really looking back at the end of the day, knowing what I know now, I can honestly say that it was due to a precipitous drop off of estrogen as she was in perimenopause. And that's what started it all, and it was just surgery after surgery. And it's insane to me. Well, it started when she was 12. This is crazy. When she was 12, her dad was in the Air Force. So she was on a base in Hawaii, and her hip was having some kind of issue. We're not sure what it was, but they used cadaver bone to try to rebuild. And they cut her sartorius and gracilis, which is crazy. Really? She doesn't have a sartorius or gracilis on one side. It's wild. So anyway, my mom's had hip issues her whole life. And the reason I got into all of this was because I ended up working for a naturopathic doctor in the early to mid 90s, right out of undergrad. And he was doing regenerative injection therapies. He was doing prolotherapy at the time. That was it. And he was an acupuncturist. And I was like, what are you doing back there? Because people were coming in wheelchairs and they were walking out on their own accord. And I was like, what is going on? And he's like, it's sugar water. It's dextrose. And I was like, what? And so I started getting into it, and lo and behold, and that's a really palpatory skill to have. Prolotherapy isn't so much about ultrasound guidance as it is about finding the pain generator with your fingers, with your thumb, with your hands. And then if you can regenerate the pain with your hands, you can inject it. And it's often just small little regions of the musculotendinous junction or the enthesis point, and really profound results. But anyway, all that to say is Prolo turned my mom's life around. But through that process, the estrogen drop led to the hip issues, which is really common. And then she ends up with surgery after surgery. All the while she's gaining a ton of weight because she's going like just slamming into menopause. And that was back when they just wanted to take your uterus out, or ovaries, or all of it. That's crazy what they still do that to women. Anyway, my mom was thrust into menopause, and her musculoskeletal system is what got hit. And so for me, my approach has always been like very multifactored, in that I always take into consideration the hormonal milieu, because that has so much to do with pain, and so much to do with recovery, and so much to do with tissues tearing and pulling. And yet the hammer that most doctors have is cortisone injections and surgery. And then they hang their hat on these damn MRI reports, which are just like catastrophic reporting. It's like misinformation almost sometimes, it's crazy.
I really, really agree with you on the hormonal side of things, because especially for men too, because men's testosterone definitely drops off, as does their estrogen. But for women especially around menopause age, that drop off in estrogen and testosterone as well is huge. Like it's super important to keep track of, and most women don't know to keep track of one, let alone both, and how to actually request from their doctors. Like if they have to get referred for blood work, like their doctors don't even do full profiles.
It's true. It's crazy. And I think it's criminal. Honestly, I think it's an ethical issue, because if that's the driver, I'm always looking to discover what the obstacles to cure are. And I'm always trying to figure out what's the pain generator, right? Like I know you're looking for the pain generator too. And we can bone it up to low protein diets, deconditioning, all the things. But at the same time, if your estrogen's dropping off and your testosterone, you're absolutely right. You've just lost your anabolic side to things, so you're not regenerating anymore, and then your tissues are more prone to tearing, because your estrogen is what's responsible for that juiciness and elasticity. And so and it can happen years before menopause. Like you don't have to be menopausal to be having some of this symptomology. You could just be a woman in her 30s that gets too lean. Like you could just get really, really lean, or you have a man I saw this with patients, young men who'd had multiple head injuries from hockey or from football or whatever. And all of a sudden their testosterone bottoms out because they've too many head injuries. And then it's just like chronic pain, chronic injuries, poor recovery, poor healing. And they're in our offices and they've got these atrocious looking MRIs. And I'm like, hold up, we got some work to do.
Oh yeah. Yeah, and that's exactly right. Like I've been checking my hormone levels, everything since I was about 22. Like I want to know my baselines. Like as early as I wish I could have done it earlier, but whatever. I have them now. I recommend to every single patient, regardless of age, to like, hey, if you're going for a blood panel, like make it a full one, right? Whether you're 20, 30, 40, doesn't matter. Like here are the tests that you should ask from your doctor to put on your referral. Get this, right? And then like not only the hormone, but even markers like ApoB, apolipoprotein B, like nobody checks that. Why not? Why do you only check cholesterol and lipid profile? You need to check the ApoB as well. Like there's so many tests that aren't tested that is critical to someone's like health and well-being, whether it's for pain relief or just overall longevity and preventative care. Like if your ApoB value is super high, your chance of a heart event is increased.
Yeah.
Why don't we try to manage and drop it down?